Hi everybody, it's Dr. Tony Ingram at Flourish Dental Boutique, and we are back on Facebook today searching through some of the crunchy Facebook groups because there are so many great questions on here, great dentistry related questions that I think a lot of people could benefit from. So today's post is broken teeth / holistic dental question. This mom says, my 7-year-old broke her adult front tooth and the root is dead. Because the root isn't closed, they have to do some kind of treatment and then recommend a root canal with an endodontist. Has anyone dealt with this before and seen a holistic dentist who recommended something else for a child so young? I've heard bad things about root canals and want to avoid them, but she's too young for a permanent and it's one of her 2 front teeth. Ugh. Well, is right. That is such a stinky situation and it's not uncommon at all. It happens really frequently. So this is one of the beautiful things about truly holistic dentistry, because that means that we take each patient as a whole person and don't just look at their tooth. So if we were just looking at this young child's tooth, then the traditional allopathic world of dentistry would say, without a doubt, the nerve is dead. We want to save the tooth. We're going to do the root canal treatment and save the tooth. And then conflicting with that is the more holistic view of dentistry that says root canals are terrible. You should never do a root canal. There are potential health problems associated with root canals. Don't do it. So they're in direct competition with each other, contradiction with each other. So what I would say is this is where we really have to take a step back and look at the pros and cons of each option and see what is the best option for this child. And the poster is exactly right. If you have trauma to a tooth in the front, a permanent front tooth, the tooth breaks, the nerve is exposed, then yeah, a lot of times the only option to save that tooth is to do a root canal on the tooth. And that is also correct that if the patient is so young that the root hasn't completely formed yet, then there's a waiting process. It's kind of a multiple step root canal situation. So it's not a fun situation to be in, but again, very, very common, especially for young kids with brand new permanent teeth in the front. Very common. I would say, if this were my child, I would weigh the pros and cons, and I would say I would most likely save that tooth, at least for now, with the root canal. And then you can always look at other options when the child is completely grown. When the child is completely grown, then you can look at possibly doing an implant or something else to replace that tooth. But if she were mine, and that's always the test that my treatment plans have to pass, is would I do the same thing for my child, my mother, my father, my brother? Would I do the same thing? So in this case, if this were my child, I would most likely do the root canal. I would go the traditional route for now and then wait and see, making sure that I'm looking at all the health indicators, that I'm making sure she is well protected with a healthy diet, a healthy gut, so that she doesn't have any of those potential complications that can come up. And we would treat the area probably with some ozone injections to make sure that we're killing any bacteria that's around the root of the tooth. That, sometimes what we worry about in the holistic world with root canal, really in any area of dentistry, what we worry about with root canals is the potential for the chronic low-level recurring infection. And so we can help eliminate some of that by treating it with ozone on a regular basis. So that is what I would do for this kiddo. Now let's look at some of the comments, and the comments, they kind of fall along two streams of thought, which is not surprising. One commenter says, same thing happened to me, but we never went the holistic route. Yeah, that's not a bad answer at all. The next one says, please, please, please do research on a traditional root canal before going that route. It's pretty controversial, and I would personally avoid it. So always a good idea. That commenter is absolutely correct. You should always do your research on something, especially when it's a treatment that your kiddo is going to do. The next one says, everyone I know that has gotten a cancer diagnosis immediately goes to the dentist and has root canals removed and all mercury fillings removed. There are some groups on Facebook about how to heal cavities naturally, and I actually have 3 books on it that I got on Amazon. I had an integrated dentist in Tucson, Arizona, do her treatment, or she goes to an integrative dentist. So this is obviously somebody who is very, very, very much a fan of the natural holistic route. Now, I cannot tell you that there is a correlation between root canals and cancer, but there's a lot of thought to support that, especially in Eastern medicine. So again, we just want everybody to do their homework. The next person says, can she get a dental implant? There are some that are made from zinc that are supposed to be more natural. That's actually incorrect. I think she means that some implants are made of zirconia that are supposed to be not necessarily more natural, but they are a little more biocompatible than the other titanium implants tend to be. And again, that's not an option for a 7-year-old. You just can't, they've got too much growing left to do. You can't do an implant there yet. Maybe consider a flipper for her to wear for a few years before replacing the tooth. Now, if she does have to be missing that tooth, then yes, a flipper is a good option. And a flipper is just a small, like a removable retainer type of thing that has a little fake tooth inside of it. So that is an option if that tooth has to go, or if they decide not to do the root canal and they would rather lose the tooth instead. And then the last one says, I have a root canal and wish I had never gotten it. Oh, I hate that too. It can be frustrating when you have certain procedures done or certain dental work done, and then you're wondering if that is what started some health effects. Again, like I said, I can't say that any kind of dental treatment is going to cause any kind of bad or good health effects other than the ones that are noted in peer-reviewed literature, but we always want to make sure we do our homework, and we always want to make sure we have a discussion with the dentist on the pros and cons of treatment, as well as the risk of doing nothing at all. So great question this time. I'm so glad we got it. And it's a common question that people have. So I hope that helps a little bit for this mama. We'll talk to you next time.